Hello and welcome to this episode of Heart and Health. In this episode of Heart and Health, we'll be talking about blood pressure. So, what is blood pressure? Blood pressure is basically the amount of force our heart uses to pump out the blood to circulate it in entire body. It is usually measured in millimeters of mercury, and usually it is reported in form of two numbers. One of these numbers is systolic blood pressure and the second number is diastolic blood pressure. Systolic blood pressure is the pressure when the heart pushes the blood out, and the diastolic blood pressure is the pressure when the heart is relaxing in between the two beats. For example, when somebody says that their blood pressure is 140 by 90, what they imply is that their systolic blood pressure is 140 millimeters of mercury and their diastolic blood pressure is 90 millimeters of mercury. When this blood pressure values are elevated or beyond a particular cutoff, the person is said to be having hypertension. Hypertension is a very common phenomena or a disease, and it is said that approximately one third or 30% of the adults around the world have it. As the age increases, the prevalence of hypertension also increases, and it is also said that around 60% patients more than 60 years of age have this problem of hypertension. So the definition of hypertension has been evolving over the past many years. Currently, there are two definitions for hypertension which have been given by various bodies. For the sake of simplicity, I'll just describe it as a blood pressure which is more than 140 by 90 millimeters of mercury. This is hypertension. Hypertension has been found to be a root cause of many diseases, and these include heart failure, coronary artery disease, heart attack, atrial fibrillation, which is a rhythm disorder, peripheral arterial disease, stroke, and end-stage kidney disease. It can also lead to memory loss. So, what is ideal blood pressure? Optimal blood pressure or ideal blood pressure is when the systolic blood pressure is less than 120 mmHg or diastolic blood pressure is less than 80 mmHg or 80 millimeters of mercury. A person who has his systolic blood pressure within the range of 120 to 129 mmHg and diastolic blood pressure between 80 to 84 mmHg is said to have normal blood pressure. A person who has his or her systolic blood pressure within the range of 130 to 139 mmHg and diastolic blood pressure between 85 to 89 mmHg, he is said to have high normal blood pressure. A person who has his or her systolic blood pressure between 140 to 159 mmHg or diastolic blood pressure between the range of 90 to 99 millimeters of mercury, he is said to have grade 1 hypertension. A person who has his or her systolic blood pressure between 160 to 179 mmHg or diastolic blood pressure between 100 to 109 mmHg, he is said to have grade 2 hypertension. A person, if he has a systolic blood pressure beyond 180 mmHg or diastolic blood pressure more than 110 mm of mercury, he is said to have grade 3 hypertension. Some people have isolated systolic hypertension. What is isolated systolic hypertension? Isolated systolic hypertension is when the systolic blood pressure is more than 140 millimeters of mercury while diastolic blood pressure is less than 90 millimeters of mercury. So I don't want to make a very lengthy video overflowing with various concepts. This was very basic about hypertension. We'll be talking about hypertension and blood pressure in coming episodes. Till then, keep watching Heart and Health.